Today we're going to talk about the FUE procedure and why it's so popular with patients. FUE refers to one of the two donor hair extraction techniques used today in hair transplantation. It's also known as follicular unit excision or follicular unit extraction. But basically, it's a procedure done with a device like this, a micropunch. But we'll talk about this a little bit later. We're going to start the procedure by shaving the hair from the back and sides of your scalp. Remember that this area is called the donor area, and it's called that because we know that the hair from this part of your scalp won't fall out. It's protected against the effects of hair loss. Okay, so the second step, once the hair is shaven, is to place local anesthetic in this whole area. This is so that you don't have any discomfort or any pain during the procedure. Once this is done, the procedure will begin. And basically what we do is identify these follicular units. I'm talking about these 2, 3, and 4 haired natural occurring groups that are found in your scalp. This is a key bit of information because if this is the way nature produces your hair, it's the way that we should transplant it. And the final step is to punch out these groups. It's going to be done with the micropunch device. Obviously, today's devices are so much more sophisticated than this. For explanation purposes, I'll use this one. So it's a circular punch, and basically we're going to create these micro incisions around each follicular unit. This is the actual movement that's going to create your grafts. Now, why is this procedure so popular? To begin with, it won't create a linear scar on the back of your scalp. So you'll be able to use your hair short, if that's your preferred hairstyle, without any risk of somebody noticing some strange scar on the back of your scalp. Now, what these small incisions do produce are these tiny little white dots. But since they're going to be dispersed all throughout the back of your scalp, they're almost impossible to detect unless somebody goes in trying to look for them. Now, the second reason that this technique is so popular is that it just doesn't seem or feel like a surgery. As a matter of fact, the incisions are so superficial that they don't even require a suture. The actual orifices produced by all these extractions are going to heal within a matter of days on their own. So you'll be able to go back to your lifestyle in a very short time frame. And that's how easy it is to understand how the FUE procedure is done. However, I think that because of its simplicity, some patients may think that all the clinics are doing the exact same procedure and all the clinics offer the exact same quality, and that is far from true. Remember, FUE refers only to the donor hair extraction phase of the procedure. But how you extract the actual grafts has nothing to do with the hairline design or with the fullness of your result. That's going to depend on other factors. So remember this, a successful hair transplant is going to depend on the balance between these three phases: the design, the extraction, and the actual placement of the grafts. FUE refers only to one of the phases of the procedure.